Can stress, dictate your delivery method?
Stress has a direct impact on mother as well as the fetus.
So the long-term effects she has to cope up with the premature or preterm baby birth.
Keeping your mental health in check is as important because it does have a direct impact, on the body and on the pregnancy as well. Good evening, everybody, and thank you so much for joining us for this special expert talk. We're going to start by opening up the floor to our experts, and the experts are going to give their insights on the topic that we have here today. And of course, once that is done, we will be opening up the floor to the audience, and we will be answering the questions that the audience has for us. All right, Dr. Sunita, I would love to start with you today. Now, like Dr. Malati already mentioned, stress is something that's a part and parcel of everybody's life today, and I think it becomes all the more important to look into it, especially during your pregnancy. Can we talk a little bit about what are some of the common sources of stress during this time? What is it that people usually end up stressing about?
Yeah, good evening, everyone. Shri, as you know, pregnancy is a beautiful moment in a woman's life. But stress is one of the factors which we need to take care of. First of all, when a patient is first time pregnant, we can say it's the first pregnancy. She's mostly aware what is happening new to her body, which she's never aware of. So first of all, what she expects is the changes which she undergoes in a human body when she's pregnant, which she's never expected. So that is one of the stress first she adds on to it. Then the second factor comes is when the baby starts growing, and she's totally unaware of how things are going to grow up, as she's never seen anything growing up to 9 months of pregnancy in her womb, or she's never seen it, or she's totally unaware. Secondly, lots of myths and things which they go through the Wikipedia or the internet session. Sometimes they are misguided in some parts of pregnancy, so which adds on to the stress. This is the second factor. Third factor is something which changes, what is going to happen. Let's consider how is the mode of delivery, how I'm going to deliver. These are the common questions which a woman and what she feels like she expects to increase her stress for that moment. Fourth question is let's think in case she delivers, she wants to know who is going to take care of the baby. I'm totally unprepared. How to handle the baby? It's a small baby, it's 2.5 kg just delivered. What is breastfeeding? What is the mode of delivery? So these are the common questions which a woman faces, or a lady when she becomes pregnant, or it's a very happy moment for her. But these are the factors which add on to the stress in a woman's life when we can say that this is a first factor, or you can say which triggers stress in a pregnant patient.
Let's dive a little bit into what are some things that women can do to alleviate their anxiety. I think for one, being as informed as possible from the right sources can really help you, ease your anxiety, because the more you know, the more you're prepared for it. Are there any other tips that you have, especially when you see your clients and your patients coming in? What would you advise them to do to make sure that they rather enjoy their journey and not stress about it?
The first thing I would advise to all the pregnant women who are undergoing this session right now, first of all, go to the right source. So let's consider if they're having some myths or any stress factors regarding the pregnancy, whether it's the first trimester, that's the first 3 months, in the second trimester from let's say up to 7 months. There are a lot of myths, especially there are a lot of grandmas and people who are senior citizens in a family who go on guiding about them. We are not supposed to do this, you're not supposed to eat, which you already mentioned. So I think first is the right source, what they have to get information. I always tell my patients, if you have any queries, do not go to any uneducational or unauthorized sources. Come and talk to the doctor directly, which will help you to reduce your stress. Madam, I was stressed up because I was told I was supposed to do this thing. I'm not supposed to eat for, like my grandma says, you have to eat for 2. So the excessive weight gain also in pregnancy also adds on to the stress of pregnancy and leads to complication. So it's not like we require the daily calories which we require in a pregnancy. Hardly it matters about a few calories which are added for day-to-day calorie expenditure in pregnancy. So it's not like we need to eat for 2 people. So we need to expend the scientific basis for these people who come to us for consulting. Secondly, they have to accept it's a new journey. So whatever you have, any ideas about the mode of delivery, talk to your doctor, you speak out about your worries, you explain to them Like if you have any stress regarding any factor, whether it is a board of delivery, the eating habits, or anything which is worrying you, find out. Otherwise, you can reduce your stress levels by doing some small up exercises. You need not have any strenuous exercises. You can just go for a small walk. You can have a little bit of meditation. You have to accept some things. This is a new journey.
Now, Shweta, because we are talking a little bit about, meditation, a little bit of yoga, physical activity. So can you help us understand the role of yoga and meditation in relieving stress during the pregnancy journey?
I'm sure that we all have the awareness towards the prenatal yoga classes, which are customized form of practice, especially designed for women who are into this phase of their life when they are really trying to connect to their baby, especially women who are new mommies or going to be first time mommies. They have a lot of apprehensions running into their mind about their body, the way it is changing, and there is so much of stress happening inside the body because of the growing organs in the belly. So somewhere physically also they are into stress due to the pressure on different organs, and mentally also they are into stress because of the changing life. So yoga is very good practice for these cases, because first thing is yoga is a kind of practice wherein you are not rising your heart rate. Your heartbeat is taken care. Your heart is already doing double the function in this phase. Now any form of exercise which is rising your heart rate a lot can reduce this oxygenation to your fetus. So that is one benefit which you are getting from yoga, where your heart rate is in check. Plus, the women in this practice are eased into alignment with awareness of breath. So when a pregnant woman, she's connecting to her body with her breath, she feels that her confidence is growing because she's getting to understand her body.
I think we've started the conversation in the right direction, and we're getting some great insights from all of you. Now, of course, the audience has started sending in their questions, and I'm sure they are very eager to hear directly from you. Dr. Sunita, Pallavi wants to know, what are some chemicals or cleaning products that we have to stay away from during pregnancy?
Normally, like when you're having a cleaning, like we are into COVID right now, everybody was using sanitizers. So only thing what we need to take precautions, like, something you have mentioned on the label, all the details about the sanitizer, how safe it is in pregnancy when you want to purchase any disinfectants or any cleaning agents. Only what I would advise, most of them are safe. Only thing is like, using hydrochloric acids or any acids which form used for extreme cleaning. We have to be more careful, especially, I don't know, we all have attendants or helpers at our home. So I think only they need to be mentioned, or she needs to be shifting into the other room if she's very sensitive to any of the agent where we are not aware of, or she's allergic to any of the agent. So when she feels like she's a little bit at discomfort when the helpers are using the agent, she needs to shift into the another room, or she needs to analyze herself to keep her in a comfortable situation where the person is working in that atmosphere.
Dr. Malati, Vandana wants to know, if a mom is already suffering from anxiety issues and then she conceives, can this issue affect the baby in the womb physically or mentally?
Not always, but if the mother is having anxiety disorder, she has to consult a psychologist, and she has to be supported by family, and also she has to take some support from she should ask for help from the family, relatives, or health consultants, so that she gets through her anxiety disorder, and so that doesn't transfer to the inner world.
Thank you so much, Dr. Sunita. Thank you so much, Dr. Malati and Shweta, for joining us today. It's been an absolutely wonderful session. We've got some great insights, and I'm so happy that so many questions got answered, and we must have managed to alleviate a little bit of anxiety for a lot of people.